Hi, everybody. Good evening, good morning. Welcome to our fourth advocacy webinar for ICNA advocacy webinar. And today we celebrate our World Children Day with for 2025 the slogan "My Day, My Right." So today we are dedicated to protect our children.
And welcome everybody to this advocacy webinar. We expect that there will be neurologists as well as non-neurologists, and therefore we have kept this very simple, but it is an important matter. Next slide, please. So in the next 20 minutes or so, I would just like to talk about the importance of plasticity in the first 1000 days. I will not dwell on this because we covered one whole seminar earlier on this. Global burden of neurological disorders, particularly cerebral palsy, autism, and epilepsy, early diagnosis and early intervention, and how we can save the children's brain in a secondary manner, preventive strategies, both primary and secondary, and a rights-based approach. So let's just see what we can cover. Next slide, please. So all of you know that the brain has different parts, and these are dedicated to different functions. But the reason I'm showing this is, although they are dedicated to different functions, if need be, different areas can be stimulated to take over the function of an adjacent area. And that is what the whole idea of plasticity and early intervention depends upon.
Thanks, Chahnez, for taking this initiative to organize this webinar on this very important day, marking the World Children's Day, which traditionally it rests on a very simple but quite radical principle that every child everywhere has the right to grow up with a healthy mind and a healthy brain. So in this my 20 minutes, I would try and show two things. One is how chronic stress and adversity can shape the developing brain. And secondly, to show how we can use this science to build resilience on purpose through relationships, environment, and practices that strengthen the systems that our children rely on in order to grow, in order to learn, and in order to thrive.
Thank you, Professor Chahnez. I'm really happy today in Child's Day to present my talk. Our patients most often face socioeconomic barriers, stigmas, and systemic gaps in care. And we should always think beyond the early intervention, early diagnosis, but also after that. Where do we stand when this patient goes home? Or what can we do besides for their healthcare? And I first want to say why this integration matters for all our patients. We are at the intersection of rapid brain development, neuroplasticity, and complex family and social systems. Advances in neuroscience align diagnostic and therapeutic decisions with identifying developmental mechanisms have critical periods for neurodevelopment and network level dysfunction. When we look in the aspect of rehabilitation, it maximizes functional gains, participation, and support plasticity. And when we look at from the advocacy aspect, advocacy ensures children can receive these opportunities and long-term continuity of care.